type of intensified screens that we use, the rare earths compared to calcium tungsten. Huge difference. And still you might see from when you see these numbers, you're going, whoa, these are not really good numbers. You expect to see 60% conversion, because that doesn't exist. And so this was and is really, really good. All right, much better than this. And here's where you see the biggest difference in the conversion efficiency, because when you pay attention here, okay, when you look at, there are some rare earths that can do better when it comes to the absorption efficiency, not conversion, absorption efficiency. They can do a little bit better. But here's where rare earths really have the class, because they can convert whatever little energy they get, they can turn it into more live photons. Make sense? Good. All right, screen speed. It is a relative number that describes how efficient X-rays are converted into usable light. Okay. The intensification, and that's what we use the number, the intensification factor, which is what you're doing is you're comparing the conversion efficiency of the phosphor, and what you do is you do a ratio. Okay. Intensification factor, IF, exposure required without a screen and exposure required with a screen. Okay. Fast screens have the greater ability to convert more. When I say higher speed screens, they can turn light with very little. They turn it into an image. Okay. The problem is resolution. Okay. There's where the problem is. And you give it a description rating, and they're called par speed and high speed. Par speed is the standard. Par speed will be 100. Okay. 100 speed, 100 RS. And high speed is everything else, everything above. Are there slower screens? Yeah, but they haven't been used in years because the patient dose goes up. Okay. Are you guys following me?
Yeah.
Okay. So high speed, this is par speed, is what is everything is compared to. This is 100. And the statement that I'm making right now is, are there any screens that's lower than par speed? Yes. Okay, there are, but they don't have a use. Even by the time I became a technologist, there was no use for those screens, at least not in medicine. Maybe in other industries, maybe they do, but not in medicine. Because of the purpose. Remember, if we go back to the purpose of intensifying screen is to what?
Reduce patient dose.
Reduce patient dose, right? That's the bottom line. And when you start going too slow, then you're not really doing that. You're getting too close to the point where almost it's like be using no screen at all. Make sense?
Mm-hmm.
Okay, good. Okay, when we talk about screening speed, you talk about radiation quality, image processing, and temperature. What is this saying? The quality of the screen, and this is what I had mentioned to you before. As the screen speed goes up, okay, you're using less and less radiation. Okay, you following me there? Does it make sense? Connecting the dots with what I had said last time. Okay. Hope you're not just memorizing. You can connect dots here. Okay. Radiation quality. So when we think of patient dose, yeah, that's going down. But the resolution, once again, the resolution is going bad. Okay. Okay. And so you need to find a combination of a screen that, or a screen system that can give you somewhat of both. Okay. All right. Image processing. The processing also changes because since you're going to have with less radiation, you're creating an image. How you process the image might change as well. You might need less or more concentrated chemicals. And the same goes with the temperature. Temperature, you might increase it or decrease it. Okay? Do you remember the example I gave you that with mammal, you changed the length of time? You guys remember that? No. When we were talking about the processor, I said mammal film requires the 2-minute processor, the 120-second processor. Why? Because it's in a slower screen film system. Okay, this is slow, and so because it requires more time to be developed.
Okay, so slower speed.
You following me? Okay, good. All right, and the same goes with temperature. When you think of image processing and the temperature, is related. One is chemical concentration, and one has to do with how high or how low the temperature is. So with the slower screens, and that's why the example of mammal, you want to give it a longer time.
So basically, the longer the time, the better image processing. Is that
It's not about better. It's about what is it that you're trying to get.
Oh.
What is the what are you trying to get with the end product with a mammal?
and better detail in order to greater
Exactly.
detail.
So in this case, yeah, you want to do that. But now, if you're doing, say, in the operating room, okay, you take an X-ray, and all that orthopedic surgeon is doing is just looking where the screw is going.
Okay.
Do you need great resolution for that?
No.
All he wants to look is see how far he's gone or she has gone with the screw in the leg. So you don't need a good resolution. So you can process it with a fast screen. Okay, make sense?
Mm-hmm.
Yeah.
It does.
Okay, and the processing will be adjusted. Now, if you're thinking, well, for all the different screens and film combinations we have to have different processors? No, that's not the way it was done. What hospitals did is typically they will have three types of screens and maybe 3 types of film. Okay, and what they will do is they will have in a screen, 3 types of screens and maybe 2 types of film. You will use the same film. Okay, and pay attention here. Okay, if you get lost, you're gonna get lost. If you have film, okay, you have the same film, but you will use the same film in different screens. And that combination will give you the speed system. Not just the speed of the screen or the speed of the film, but the speed of the system. For example, the great majority of our affiliates, with one exception, they had the same film and they use it for regular work, abdomen, chest, whatever. And then they use it, and then they use another screen for extremities that will give you better detail. Do they use different type of processing for that? No. You could process both films, both systems were processed in the same processor. There was no change. The change was made with the screen. Following me?
Mm-hmm.
Now, you also had another set of film and screen for mammal. Okay, and mammal did require a separate processing system. Okay, see the difference?
Mm-hmm.
Okay, good. So you were not looking for a bunch of processors. You didn't have a dark room with 5 different processors. No, you have typically 2. One for regular work, everything you did, extremities, chest, abdomens, whatever. And then one just dedicated to mammal. Okay. The exception was San Mateo County. San Mateo County had, in addition to having mammal film and regular radiographic film, they also had extremity film and extremity screens. So they had extremity screens, extremity film, regular screens, mammal film, and mammal screens. So they were the exception. Okay?
So, I'm sorry, so did you say there's 2 different intensifying screens for mammal and regular x-rays, and then there's also 2 different films? For
No.
mammal and x-rays?
No.
Only 2 different screens?
So what I said is for mammal, you use 1 type of screen and 1 type of film. Okay, and they were separate. Okay. And now for every other type of work you did, you had the same film and then 2 screens. 1 slow screen, 1 high speed screen.
Oh.
And that was it. for example, if you look at this, these screens, you will put the same type of film inside both of them. The screens are different. See, this is a screen that has the dotted borders. That's the extremity screen. Okay, but when you went into the darkroom, there was only one type of film. So when you open it, they look the same, but they are different. So can you tell me which one is slower, which one is faster? The extremity is the slower, okay? But same film, okay? It just makes it easier. So hospitals didn't want to complicate the life of the text. I told you there are dozens and dozens of type of film. If you start, it can get pretty crazy, pretty hectic. Okay. The reason San Mateo County did it, I think it was just because of resolution. If you had seen their films 6-7 years ago when they were using their extremity film and extremity screens, they were beautiful, but they were using twice as much radiation as everybody else. But the images were just gorgeous. We okay? All right. Image noise. Noise is anything that is not really part of the image. Okay? Anything that is not part of the image. So when you talk about noise, really you're talking about more scattered radiation when it comes to film. When we get into digital, we're going to learn that noise is not only scattered, but it's other stuff that can be added to the image electronically. But for now, we're just studying film and screens, and here, noise refers to scattered radiation. The faster the screen, the more scattered radiation it can capture. Okay, just because, why? Because they are very sensitive. Every little bit of radiation, they catch it. And so you had more noise. Okay, another type of noise that we will learn later on in this class is when you have a dotted image, and that is quantum model. I think it's an M here at the end, quantum model, and that's a dotted image, okay? And that was common with high speed screens. And the dotted part also influenced resolution. And I told you, I've been saying this, I don't know, this is probably my 10th time. With higher speed screens, you lose spatial resolution. Okay. All right, screen speed classifications. So you have relative speed. So this is how they were known. Relative speed, RS, that's what that stands for. Relative speed number. Far speed, I mentioned this before, is you assign that a number of 100. Okay. The calcium tungsten screens, they were 100, and that's why I said that's the standard. That's the way you compare everything with. Remember? Mm-hmm. Okay, good. Then you have anything above that, okay, will be high speed. And you had speeds going from 200 all the way up to 1200. Okay. What most hospitals did, you can make a note there below here. What most hospitals did is they used the 200 speed screens for extremities to give you better detail. And then for everything else, for regular work, they used the 400 speed. Okay? And don't forget, Monday we have our quiz, right?
Yes.
All right, good. Just remind me. Okay. All right, and then If you, were there other speeds used? Yeah, and it depended on the hospital, but most commonly 200 and 400. Now, I also remember remember working with 800 speed screens, and they were done for angio. Now, I'm talking angiograms before the digital era, okay, where we had to do films. And with angiograms, what is an angiogram? Anybody?
When you look at veins,
Veins or arteries, right? And sometimes you can look at the brain and brain vascularity, or the heart coronary system, or any small vessels anywhere. What they do is they place a catheter in a large area, in a large vessel. Typically will be the femoral, and from there they move anywhere they want with the use of fluoro, and then they inject contrast media. So when you're doing angiograms and they are doing what they call runoffs, this is when they inject the contrast media and they chase the contrast media where the contrast media is going. Just imagine, how many times does your heart circulates blood?
Pretty quick.
It's extremely quick. I mean, the blood that you're seeing here right now, in the next second is probably already in my liver. That's how quickly it's going. It's going extremely fast. And so when you inject contrast media, the contrast media is not going to be sitting there. Okay, it's not. It's going to move everywhere very quickly. And so what you do in angio, say if you're doing, I don't know, say you're doing the iliacs, let's say both. Okay, you inject and then you take a series of pictures. Say you take 15 frames per second or 30 frames per second, so you don't lose the sequence. See how quickly we're talking about?
Mm-hmm.
Think about it. What is a second? That. You have done 30 pictures in that amount of time. It's very quickly. So you're going. When you're doing that, and you're doing that rapid frequency of films, you need something that can respond as quick, and so that's why that's one reason why they use the 800 speeds or higher, the 1000 RS speed. At the same time, you don't need great detail. Okay, you don't need to see. You're not gonna see fractures. You're not gonna see this. That's not what you're looking for. You're not gonna see microcalcification. You just want to see that blood is flowing. That's what you're seeing. You want to make sure that the vessel you're looking at is, that you have contrast media flowing. If you see contrast media flowing, that means that blood is flowing. If you see that the contrast media is stopping, you know that something is going on there. Maybe a blood clot, maybe a malformation, maybe something there. Okay, or if you see contrast media leaking off the vessel, you know that the patient has a cut vessel and has a hemorrhage, right? And so that's what you're looking at. So you don't need great detail, and so you could use the higher speeds. Yeah, you're losing resolution. You're gonna see more, all of that. But you're looking just at the vessel. That makes sense? And so that is the case when using a higher speed was convenient. You following me? Okay, good. And then you had also the very fine detail, okay, that were even lower than the par speed. As low as 20. The price you pay with speeds like this was what? Patient dose. Dose goes up. Okay, dose goes up. Okay. Great resolution. But it's just it's not convenient for the patient.
Yeah.
All right, so now we're switching gears. Okay, we have to explain what resolution is. We're going to come back to this concept when we study density, contrast, and move back to resolution, but I have to give you a little bit of resolution since we're talking about intensifying screens. So resolution is the ability of an imaging system. When you hear this term, imaging system, that refers to the combination of the screen and film. So an imaging system is the combination of the film and the screen. So ability of an imaging system to accurately image an object. How good can you image whatever object, in this case the foot. Okay? Inversely related to, and here's where you need to pay attention. Inversely related, meaning what? That it's going to get worse. The resolution is not going to be as good when you have big phosphor crystals, when you have a thick phosphor layer. Okay? All right. So, let me ask you something. What do you think? What of those two images do you think has better resolution?
I see.
From the definition I gave you there. I see your hand, Derek. We'll ask somebody else. This time. Okay, you want to see hands? Not just Garrett's. What do you think, Annie? You're right in front of it. So what do you think? Which one is better? Which one do you see more resolution?
I'm not sure which one is better. Maybe the
Which one do you like?
I like both. Okay, okay. The first one's better to me.
The one on the left or the one on the right? They're both first. I read from right to left.
The left.
On the left. Why?
I can see more detail. And little bit higher contrast.
I don't know what you're talking about. We're not talking about contrast. We're talking about resolution. Two different things.
Resolution, how good the images could be.
Think about it. We'll come back. John, what do you think?
I think the one on the right looks less grainy,
Ah, okay. Less grainy. Okay.
and then the other one has more density, so I'm thinking that that must be a thicker layer of phosphorus crystal. But these are the images, so it's not screen mode, yeah.
Those are the images.
There's more detail on the one on the left in the brighter areas.
Okay, anybody else? Dennis, what do you think?
I think the left one, because the right one has more scatter, and the left one you're able to see.
Why do you say it has more scatter?
I think it because if you look at the outside
The soft
of,
tissue, this area here?
the soft tissue, it's lighter compared to the left one, and related to the bones, you could see the bony trabeculation better on the left compared to the right.
Okay, and there's where we go. Let's look at the definition of resolution. Ability of an imaging system to accurately image an object. Which one of the two best represents the bone and the soft tissue of the foot? Jesus?
The right?
Yeah, the right.
Okay, why is that?
You can see a better bony detail also on the right one.
This one here.
Yes.
If you look
Which area you're looking at?
at the fifth phalanges,
Uh-huh. Okay, here, or where?
yeah. that
Here?
area, yeah, on the top.
Here?
Yeah.
Okay.
Mhm.
But now, let me point at you something. Look at here.
That's where I was looking.
Okay? Look at here. Compare the two. Here, here, here. We're looking at the bony trabeculation. Remember, resolution is measured. How is it measured? Numerically. You know that. Look at your notes if you want. Ethel, you're good at that. Take a look at your notes. Take a look at your notes. You don't have it yet? Oh, come on. Annie, you're really good at that too. You guys were in my lab last year, so I know
Imaging
that
system is
semester.
what again?
I know everything when
Oh,
it's
it's a
been notes.
combination of screen and film.
Done.
Yeah, I looked at the right one, and I see that it's not, the paper is not blackened out as the one on the left.
Mhm.
Using measurement
Yeah, numerically. How do you look at resolution?
into millimeters?
Ah, there you go.
Okay.
Millimeters what?
IP?
Huh?
Is it LP or IP?
LP. What does LP stand for?
Lines per millimeter?
Lines per millimeter. How many lines can we see in a millimeter? You guys remember that now?
Yeah, 10.
All right, so numerically, resolution, you look at it, lines per millimeter. How many lines, which lines are we talking about? Small lines, say if you put
The pixels.
no, wires, say, bunch of little wires, like a restrainer you use for food, right? Do a radiograph and see how many of those fine lines on the restrainer can you see. Okay, the more lines you see, the better the resolution. So the same goes with the trabecula. The more trabeculae you can see, the better the resolution. Yeah?
Yeah.
Okay.
That's why I think
So
the left.
now, so when we think of it, where do you can see more trabeculae? Here or here?
I think the left.
The left, exactly. So this one presents better resolution.
The cuneiform.
Okay?
Like,
You present better resolution. Now,
yeah.
we're not talking about contrast and then, no, we're just talking about resolution. This one presents better resolution because you can see more trabeculae. Okay? All right, these pictures came from Carlton, so you can go see the picture in Carlton. Okay. In case you're still doubting which one is better and why is better. And which is good. If you don't trust me, that's good. It is. I mean, go find out. Yeah, go look it up.
So do you suggest to read Carlton for this whole class?
No, I
right
said
now?
look at the picture.
Okay, just the picture, but,
And which book to read?
Both.
well, you wanna read all of it, but,
If you haven't, if this is how I see it, this is what I've been telling people. To read Bouchon. If you have a hard time and not understanding, you read it once and it just completely doesn't make sense.
Yeah.
Okay, then go to Carlton. Carlton will be easier to read. Read it, understand it, and then go back to Bouchon.
Okay.
Because Bouchon goes in most sections, not all sections, but in most sections he goes into more depth.
Yeah.
Okay. Bouchon is a physicist. He's a medical physicist. And Carlton is an X-ray technologist. Okay,
tell.
with, he's a teacher.
Mhm.
He's an
You
X-ray
could tell.
tech, so, yeah. All right? Okay, all right, so let's go back here. Anything else? Any other questions? Okay, let's move on then. So, resolution, it is directly related also, in addition to what I have said here, okay? So inversely related to what? What did I say about phosphor crystal size?
Like the bigger the phosphor
Uh-huh.
crystal size are, the
Uh-huh.
less resolution you
Uh-huh.
get.
Here?
the
Thickness.
bigger, okay.
Bigger, the worse it gets.
Okay. So now let's look at directly related to, not inversely, like we were saying previously, directly related to the concentration of crystals. What is this saying? Huh? Yeah, no, I'm saying
Phosphor
the more, okay, the more crystals you have, the better the resolution. Okay, that's why it's directly related. So the more of that, the better you will be. Okay, so let's take a look at here. Now, look what happens, and we're just gonna look at a couple things here. Look at the layer thickness. This is the film, and this is the screen. Remember, your film is sandwiched here, but right now we're just looking at one screen, the front screen. This is screen here, this one. So here is you have the film. So the film is right next to the screen. So this is what we're seeing here. Okay, and take a look. With a thicker screen, with a thicker emulsion of screen phosphor layer, active layer, what you have is, if we have it here, just because of geometry, when the X-ray interacts with the phosphor, it will emit light, and the distance the light has to travel is less, and so the light only expands to here. Here, because of the thicker screen, you can have phosphor at a farther distance. The light that is created by the phosphor spreads more. Remember, light, just like X-rays, is not going in a straight line. It's diverging, right? And so the same thing happens here. So it is, so when you look at film, the light has spread more here than here. So light is more concentrated here. That gives you better resolution. So this explains the layer thickness. So better resolution with thin phosphors, with thin screens. Now let's look at phosphor size. Okay, the smaller the phosphor size, okay, the same thing that happened here. Okay, very narrow area that is exposed on the film. Okay? With a thicker, phosphor, it expands more. If it expands more, you have less resolution. Okay?
The greater width, the greater resolution.
So the bigger the phosphor, the better the resolution.
Nope, worse.
Oh, the worst.
The more, look at this,
Sorry.
the more it expands, the more the light expands, the more the light exposes the film, the wider that area is, the worse the
The
resolution.
worse the resolution.
You want to have a fine line, like you do here and here. And that's what I had said here, directly, inversely related to, take a look, phosphor crystal size. So the bigger the phosphor size, the worse the resolution. The thicker the phosphor layer, the worse the resolution. So that's what I'm demonstrating here. Ms. Morales, what do you think? Make sense?
Yeah.
Yeah? Any questions? No? All right. Yes?
I don't really understand how the size of the crystal makes it. Can you explain that?
Yeah. So remember, here, you're, what you have is physically, not only an idea, but physically is a bigger crystal. It was allowed to grow more. When you were creating the crystals, you let them to be big crystals. And so it has the capability of absorbing more X-rays and emitting more X-rays. The problem with that is that when you look at the geometry, it's going to, because it's bigger, it's going to stretch the light even more. Okay? So that's just a term that I'm using, but what you're doing, light is being created isotropically, and so it's being expanded a wider area. And when you have a wider area in the film, that will give you less resolution. Okay? Yeah. Think of it a light bulb, right? You have a small, tiny light bulb, then you have a bigger light bulb. And same brand, same type of light bulb, because you can have the little ones now, they have a luminance of, I don't know, 4,000 or whatever, so they're really bright. The ones that the cops use and put in your eyes, yeah, they're really bright, right? And the light bulb is really small. And I'm just talking the same type of light bulbs, okay? You put both, one, a small one can only illuminate so much. The bigger one will give you more light. So it's the same idea here. Okay. So far so good? All right, you guys are good.
So,
Excellent.
Yeah, with this,
Huh?
with the slides. Makes more sense.
All right, resolution measurement. All right, the naked eye, I told you before, about between 10, if you can read 10 lines per millimeter, geez, yeah, that's better than 2020. There wasn't a student here a couple years ago. His vision was better than 2020. Wow, it was crazy.
that's impressive.
Yeah, no, it was very impressive. Yeah, and
Thanks.
so you don't see that very often, but there are people that can see 20 lines per millimeter. Most people can see about between 10 to 11, 12, okay, for the most part. But the naked eye is capable of reading 10 to 20 lines per millimeter. okay? Direct exposed film, I had told you this before. Take a look, about 100 lines per millimeter. Okay? It's exceptionally well. The price for this is what? Patient dose. Good, you're getting it. Good, patient dose. All right? And see, what's the point of going to 100 lines per millimeter when your eye can only see 20? So you're wasting 90 lines per millimeter, right? Who cares? You don't see them anyway. Detail screens, take a look. They can be, and I'm talking about the really good detail screens, about 15 lines per millimeter. Par speed, okay, 200 speed, can show you about 10 lines per millimeter, approximately. Well, it's more like 7, but it's between 7 and 10, different types, between 7 and 10. High speed can show you about 7 lines per, up to 7 lines per millimeter. So they were pretty good. Take a look. Even high speed. And this is more at a speed of about 400. Okay? So far so good? Digital systems. All of you that are into the newer stuff and yeah, we get newer is better, can only show you maybe 2 and 3 lines per millimeter. You're very expensive, your $150,000 detectors can only show you about 3 lines per millimeter. Yeah.
Question, you said that par speed was 200?
Par speed
It's
typically
typically
about
100.
200.
Oh, so that's
Yeah, and it
200.
goes, the range that you will see is between 7 and 10. This one you will see ranges between 3 and 7. Okay. So I'm showing you here what this is, and this is from Bouchon. What he's showing you here is the maximum that you will see. So far so good? All right. All right, film screen contact is also very, very important. You have to have good contact between the screen, between the 2 screens that you have here, and the film. Okay, when you close it, when you feel the screen's back here, what you have behind it is foam, and the purpose of the foam is to push the screen forward, to push it up. Up this way and up this way, so you have a really good contact with the film. If you don't have good contact with the film, you're going to have problems. Your resolution and also your contrast will decrease. Okay, what you're seeing here. See, now your phosphors, even though they have the same size as small phosphors, they are too far apart from the film. Okay, and the light is just expanding a lot more, and the light intensity is also decreasing here. So you see there's going to be less contrast here, less density as well. Make sense?
Mm-hmm.
Okay, so you need to have good contact. So it was not a good idea, for example, people, once again, you guys are not gonna work, or you're not working with this, but if you work with this type of the system, if you're gonna be working with film, it is important not to sit on it. Okay, people sometimes sat on it. What do you think you got on the screen? A button. Right there. Yeah, people sat on it. I'm serious. Yeah, I'm serious. That's what you had. Okay, or what people will do is they will do weight-bearing feet, and they will have the patients stand on the screens, and that will win the screens, that work the screens. So if you end up working with this, you have to make sure that you don't put any weight on it, because that will happen. You're going to have areas that are going to be closer to the film than other areas. Important. There is a test that is done to measure that, to see if you have good contact, good film screen contact. And it's called the film screen contact test. What you have is just have one. There's you will put this screen on top of the your radiographic screen, make an exposure, and then you see every area, every point you see here, it should show the same intensity. It should show the same resolution everywhere, like this one. But now look at this one. Something happened here. They put more weight here. Okay, this screen is ruined. You cannot keep using this screen. okay? Maybe they had the patient stand, or, I don't know, okay? All right, let's take a break. We'll come back when we come back. Let's take a 10-minute break, so come back at 11.